Good evening, Yorktown. It's Supervisor Matt Slater. I want to begin by wishing everyone, all of our moms in the community, a very happy Mother's Day, happy and healthy Mother's Day. Today is Saturday, May 9th. I am joined by some very special people. Again, this is our weekly Q&A session that we have regarding coronavirus. I have with me, of course, our Councilman Ed Lachterman, President of the Yorktown Chamber of Commerce, Sergio Esposito. And with us today, we're very excited to have Dr. Kohl, who is the Chief Medical Information Officer, Senior Medical Director, and Chief Safety Officer for Caramount. Gentlemen, thank you so much for joining us today. We really appreciate it. I want to start real quick, if we can, with just some updated statistics and information for people at home. The latest numbers we have from Westchester County as of yesterday. Westchester cases are now at 30,905, which is an increase of 197. Westchester tests, they've tested 107,466 people in Westchester County. That's an increase of 2,224. Westchester fatalities, this is again something that we're getting from the County Department of Health. Westchester fatalities at 1,191, which is an increase of 4. New York State cases is at 330,407, which is an increase of 2,938. New York State tests, they have now tested 1.1 million New Yorkers, which is an increase of 31,627 from the day prior. And New York fatalities is now at 21,045. This was as of Friday, so it doesn't include what was reported today, but 21,045, which is an increase of 216. Here in Yorktown, the total coronavirus caseload is at 551. We have 33 active cases, according to Westchester County Department of Health, with 4 new cases. So Yorktown's done a tremendous job flattening that curve and adhering to the social distancing and social responsibility parameters that the town, the county, and the state have put forward. I want to give a big thank you to our friends at Lowe's. Yesterday, I joined a number of all of our first responders actually in the town of Yorktown, including the Yorktown Police Department, Yorktown Volunteer Fire Department, the Yorktown Volunteer Ambulance Corps, the Mohegan Lake Volunteer Ambulance Corps, the Mohegan Lake Volunteer Fire Department, and the Mohegan Lake Professional Firefighters. Lowe's donated 10,000 KN95 masks to our first responders in the town of Yorktown. Just an absolute tremendous gesture and will of support from our friends at Lowe's. So again, I want to thank them for their incredible generosity, leadership, and partnership here in the town of Yorktown. The other day, I had Kim Anglis-Gage on with me. Kim is the director of our refuse and recycling program. She provided really great information for folks at home about our recycling program, our garbage program, our bulk pickup program. That information, that video is on our website. It's on our YouTube page. It's on the refuse and recycling website as well. I do want to reiterate a couple of things. There have been new changes to the bulk pickup schedule, again, because of the volume. And we discussed just how large that volume has been when Kim was here. So here's the updated schedule. Section 4 is now scheduled to begin this Monday, May 11th. Section 5 is now scheduled to begin May 26th. Section 6 to begin June 8th, Monday, June 8th. And Section 7 to start on Monday, June 22nd. Again, this is all because of the high volume, and again, we're working with a reduced staff, so it's taking us longer to get through all the sections. We also ask that you please don't put out your bulk trash until it's your week leading up to that, and that's very important as well. Also, please note that the May 26th, we had originally scheduled for the week of May 26th, a second round of the leaf bags and bundled branches pickup that has been canceled. So please make note of that. And of course, any questions, you can go to yorktownny.org /refuse recycling, and all the information can be found on our website. I also want to remind folks, I know today was a little strange with the weather. It's May, but it snowed a couple times. Tomorrow's supposed to be a nice day. As a reminder, our passive parks remain open, all of our 40 miles of nature trails. As a reminder, we do have no parking zones in and around T-Town, as well as over at Turkey Mountain. So please, if you see those no parking signs, adhere to those. That's important for your safety and the public safety as well. Two last items I want to just mention. The census, believe it or not, the census is still ongoing. And I really got to commend the town of Yorktown. We are at a blistering 70.5% total response rate as of May 7th, which is very, very impressive. And we are easily one of the top 10 responding communities in the county. So keep up that great work. If you haven't responded, you still have time. And so you can please do so. You get the cards in the mail. And lastly, mark your calendars for this Thursday, May 14th, from 1 to 4. We're going to be doing another mask distribution for our seniors right here at Town Hall, in the parking lot next to Town Hall. Again, that's from 1 to 4 for our seniors here at Town Hall on Thursday, May 14th. On Friday, May 15th, from 1 to 4, we're going to be at the Jefferson Valley Mall. That will be open to the public, so anyone can come with a proof of residency and pick up a reusable mask. These masks were provided by Hanes and given thanks to Westchester County and our friend County Executive George Latimer, and distributed to all the municipalities. And so we are doing our best to get them out to the public and to those in need. So again, Thursday, May 14th, here at Town Hall for our seniors. Friday, May 15th, over at the Jefferson Valley Mall. Hours are 1 to 4. So mark your calendars, and we'll be pushing that out as we get through the week. And so, again, we have with us today Dr. Lewis Kohl. Very excited to have you here, sir. Thank you so much. For folks who want to ask questions, you know the drill. You can call right here, 914-962-5722, extension 216. Again, 962-5722, extension 216. You can call right here. Or you can post your question on Facebook. Councilman Lachterman is monitoring our Facebook page, and he'll be relaying any questions that we might get. But Dr. Kohl, if you could, why don't you give us a little insight about what you're seeing? I know that you're a bit of a COVID expert at this juncture. At least that's what I've been told. And so, why don't you give us a little insight from your standpoint about what you're seeing regarding our continued efforts to flatten the curve for COVID-19?
All right.
And do that while I answer this phone.
Sorry if I cringe a little bit while people talk about COVID experts. This virus has been around for 3 or 4 months, so it's hard to be expert on it. It's a frustrating little bugger. It keeps changing the story on us pretty often. We're literally rewriting the book on how we're dealing with it every day. So what we're seeing, which is great, is that new cases are decreasing. We're still diagnosing cases. Claremont has 44 offices, and we're in 5 different counties, probably biggest in Westchester. So, and even down into the city. So our spread is pretty big. We are seeing new cases in most counties. So it's really critical not to let your guard down yet. But it is really encouraging that the new cases are decreasing and new cases at the hospital are decreasing. All of the hospitals are reporting fewer and fewer patients, not none. And the fact that there are still new cases being diagnosed is definitely of concern. So you've got to be careful. We know very well at this point that personal protective equipment, particularly masks, work. So you've got to wear a mask when you're outside. Everybody around you should be wearing a mask. It still helps to keep your distance, even from people who have masks. So that's pretty critical at this point. I don't know if I should keep going on.
That's appreciated. I have someone on the phone right now, and Councilman Lachterman. I'm not sure if you're getting questions on Facebook.
I have a couple that would go straight to the doc. Yeah.
Perfect. So Councilman, why don't you provide those questions over to Dr. Kohl, and then I'll get to the phone question next.
Doctor. So the first question is, The new problem in children, is this something to be concerned about in childcare?
So if you're talking about what they're describing as a new inflammatory condition, something similar to Kawasaki disease, we don't know yet that it's because of COVID. Like everything else with COVID, it's getting to be pretty easy to blame it. So it certainly might be related to COVID. It's still obviously in a very small number of children. It's up to over 60 though. So it's just like anything else. You just got to watch for it. If your kids get sick, what we're seeing with it is, Kawasaki's is something that we've seen for many years. It's pretty rare. We usually see it in children less than 5 years old. This new they call it multi-organ inflammatory syndrome, meaning multiple parts of the body are involved. They're seeing it from young kids all the way up to young adolescents. It's fever, it's rash, it's abdominal pain, nausea, vomiting, has some of the signs of Kawasaki's disease, which is swelling of the tongue, drying and cracking of the lips, swelling of the fingers, of the palms of the hand, of the soles of the foot. So if you have any concerns about your child, reach out to the pediatrician. If your child is healthy, your child is healthy. It was great news that this COVID virus really didn't hit kids hard. That's part of the problem is young folks had the virus in their body and were probably very effective at spreading it.
Can you expand on that a little bit, Doc? Could you talk about how? Because I'm curious, because I've got small kids in my house, right? I've got a 4-year-old and an 8-month-old. So asymptomatic, obviously. Do they transport the virus? Do you believe that that's a high likelihood? And how do we as a community deal with that or manage that?
So we know from a few studies, I shouldn't say small because they're getting bigger, that probably at least 25% of people who have this virus had no symptoms whatsoever. We saw that on one of the Navy ships, one of the big aircraft carriers. Probably another 50% have only a very mild illness. They say, I had a sore or scratchy throat, I had a little bit of a runny nose, but I felt better the next day. Problem is, you can be contagious for usually 1 to 2 days before you're really sick, maybe as far as 3 days, and you're usually contagious 2 to 3 days after you start getting sick. That's with just most colds. This virus, you could be contagious a little bit longer, perhaps up to 9 or 10 days. We're hoping that's all it is. And we'll talk about some of the testing after what we're seeing. So what we tell everybody in our practice is assume everybody can have this virus. We started our folks wearing personal protective equipment as early as we could. We were lucky we had a little bit of a stash of it because I'm a bit of a paranoid. And we always maintain N95s and gowns and goggles and things of that nature. So we had our staff masked up very early. We went to masking everybody who was still at work. We masked up. We began masking our patients 6 weeks ago. That's what everybody should be doing. The kids could still be carriers, but probably not for longer. When people aren't very sick, it's unlikely that they carry it for 3 or 4 days. I'm going to hedge everything I say because, like I started out with, we keep finding out we were wrong about what we thought about this virus. So I hate to be too definitive. But the people who had no symptoms or mild symptoms, how many people's 2 and 3-year-olds don't have the sniffles or a sore throat or a tug on their ear?
Right.
It could be a regular virus. It could be COVID. So the good news about being young is for most young people, this is a very mild or almost non-existent illness.
But the concern that, hold on 1 second, Sergio, I'm sorry, but the concern that we've been continuing to guard against is it's mild for children, but the concern, and I'm just trying to wrap my head around this, is that does the concern remain that they could still transport it to people who it could significantly or severely impact?
And that's exactly what we're worried about. That's why everybody's home. That's
right.
Why social distancing. So a sick kid, a 1-year-old can't wear a mask. They're coughing and snotty.
Yeah.
They can absolutely transmit the virus. The kids are fine, you're fine, you take them to see grandma or great grandma, and bad things start to happen.
You literally just described my life. How do you like that?
So that's why, especially at this point, as we start to open, the folks who are vulnerable need to be even more careful. The elderly, the folks with chronic medical illnesses, maybe with some immune suppression because they're on a medication, they need to continue to hide out at home. If they're going to go out, they need to be very protected when they go out, to be separated from people. They in particular can't let their guard down.
And I think that's really important. And Sergio, I know you had a question, so jump in here in 2 seconds. But I know that's a really important point. So even if we're talking about reopening, even if we're beginning to phase the reopening process, for our residents and our neighbors listening, you have to keep your guard up. You have to continue to be ultra cautious, because especially when we start reopening and people start re-interacting with each other and they're not at home, you could see a spike. Isn't that correct, Doc?
Well, that's what we're worried about, when people start to come out of their homes. And if it's a spike amongst, I don't know, should I continue on your
Yeah, you continue. It's okay. Don't worry, Doc. You continue.
If it's a spike amongst young folks, it's less of a problem if the elderly and those who are very vulnerable are still hidden safe at home. But if it's a spike amongst everybody because those who are very vulnerable have gone out and they don't wear masks and they don't wash their hands frequently and they let people into their homes who could bring them the virus, we're going to be right back where we started.
So, Doc, I really appreciate, you honestly, I speak to a lot of people on this, and you seem to have a fresh perspective, which is, I think, a reality-based, you're careful not to be too positive, but you're not being too negative. And, that's refreshing, because either you hear, one side of the spectrum or the other. We've been very curious about whether or not the hospitals are in Westchester County, our local hospitals, Northern Westchester Hospital. Is it overcrowded? I mean, what is the status? Can you tell us? Can you comment on that?
So the New York City hospitals got absolutely hammered. They were overflowing. They had to open new units. Patients overflowed into some of the emergency sites that the Army helped open, like the Javits Center. That really didn't happen up in Westchester, particularly not in northern Westchester. I have to say the local hospitals did a superb job of keeping everybody safe, taking really good care of patients. They had a lot of ICU patients, more than usual, but they didn't get truly overwhelmed where they were putting people out in hallways, like you see some of the pictures of the hospitals in Queens and the Bronx. They certainly had to expand. I know Northern Westchester Hospital had to expand its ICU into an area where they don't usually expand. So they got bigger, they flexed as they needed to. Northern Westchester built a tent in a parking lot and was ready to take overflow patients, but I don't think they ever had to put anybody in there. I think Westchester, particularly Northern Westchester, the towns, you guys, and the people of the towns really did a great job on isolating themselves and being very cautious, because it could have been much worse than it was.
Doc, I had a question from someone who called in. If you wouldn't mind giving us your thoughts on this vitamin intake, vitamin D, vitamin C. I think he said zinc. He's reading that boosting the intake is being encouraged to help someone's immune system. Do you have any thoughts on that, or any recommendations on how much someone should increase their intake of those vitamins?
So the first thing I'll say is be very careful what you're reading on the internet. Most of it is not based on science. Stick to the Center for Disease Control, the better papers, the Washington Post and the New York Times, the Wall Street Journal. There's a lot of pseudoscience out there. The key is to stay healthy. What you do to maintain your immune system on a regular basis, basic vitamins, but really good meals, like lots of fruit and vegetables, just a healthy, balanced diet. There is absolutely no evidence that taking large amounts of any vitamin in particular, or zinc, the internet was all a rage, and that zinc keeps the virus from getting into your body. It does that in extreme concentrations. if there are some other things in your body called ionophores that help the zinc get into the cells. You could blast your body with zinc, but it's not going to get into the cells. So don't do it. All you're doing is benefiting the vitamin companies. Eat well. A couple of vitamins are not going to hurt you, but don't go bananas. This is not going to keep you from getting COVID. All of the home remedies, the things you're seeing that governments close beaches to keep you from getting the vital essence of what's in the ocean. Come on, we have to all be smarter than that. It's literally silly, but the problem is some folks, when people are frightened, they do odd things. They behave, I've got to do something. That's the problem with a virus that forces everybody to stay home. We have plenty of time to think, plenty of time to worry, and what you're thinking is, what can I do now? The reality is in disaster situations, most people don't actually panic. They just need a focus. They need something to do. I always tell people, because having been through several disasters when I was down in the city, anthrax and 9/11, people are spinning around the room. You give them something to do. You give them a focus, and they're immediately fine. They will focus on that and do something. The problem is we have all these folks at home really without a focus. So they're worried about, what can I do? I'll take mega vitamins and I'll try. We had people in the beginning taking aquarium cleaner because they heard it had hydroxychloroquine in it, and they died within an hour.
No.
Don't go. Oh, yeah. The wife might have survived. The husband died very quickly.
Oh, my God.
So, yeah. Don't go there with, there is no conspiracy trying to spread COVID around the world. It started in China. It spread. It was an animal virus that came to humans. So anytime these animal viruses, like Ebola is another example, flu every year, goes from animals, chickens, to pigs, to humans, these viruses mutate a little bit. And that's what we're seeing with COVID, is we just don't know enough about it because it's a completely new virus. That's why I always laugh when someone says you're a COVID expert. In my 3 years of experience, yes. That's all I've done for 3 months. So, but it's hard to be. This is not like something we've studied for 30 years.
Correct. Yeah. So as much of an expert as one could be, considering the time frames. But
in my 90 days, yes.
Exactly. But we appreciate all the insight. Councilman Lachterman, did you have more questions on Facebook you wanted to get?
Absolutely. And two of them are sort of semi-related, but I will say that I understand one of those aquarium cleaner cases is actually being looked at as a murder, that the wife killed the husband.
Really?
My wife was copiously taking notes and going out to buy an aquarium set, but
it's always the spouse.
That's it. Okay, so earlier this week, a German lab called Euroimmun AG introduced a COVID-19 antibody test kit that has been improved in the United States with 100% specificity. When will that test come to Yorktown so we don't get false positives? And in a related question, there was a question if children should be tested for the antibodies as well.
All right, so great questions. Really happy. Let's talk about testing for a minute. So,
please.
Let's talk first. So there's two kinds of testing. There's PCR, which is the nasal swab, and then there's antibody. Let's cover PCR first. PCR is really what you need if we want to know, are you infected now? And could you be transmitting it to something else? We do a swab. We were doing swabs where you stick this, for anybody who had it, this swab all the way to the back of the nose, almost tickling the brain. It's very unpleasant. We've done enough swabbing now. They tested, you can get away with doing just a nasal swab, just each side of your nostrils. So it's much more pleasant. It looks for RNA that the virus produces, like DNA, RNA, that your genetic material.
Got it.
So that's a test that this is what we actually needed in February, but we didn't get it till mid-March to be saying you're sick or not sick. We were in a situation where we were sending hundreds of people telling them just stay at home. We don't know if you have it, but we think you have it.
Right.
That's when we really needed the PCR test. So the PCR test is now widely available. Worst case scenario is 48 hours. but a lot of locations like ours have started to do same-day testing. The quantity of that is still on the low side. So depending on availability, probably within the next 2 or 3 weeks, it's all going to go to same-day testing. The manufacturers are just ramping up. But the worst case scenario now is really 48 hours to get the PCR test. The antibody test. So FDA, trying to be helpful, started just telling different manufacturers, well, you don't have to submit your test for approval. You can just release it if it meets these criteria, but the criteria were really too lax. They went back and now you have to get what's called emergency use authorization. These kits, a lot of people are very skeptical about them. Because you get emergency use authorization, you're telling FDA how your kit did. You don't have to prove it yet. Within 6 months, when the disaster is calm, they're going to have to prove to FDA that their kit is 100% specific, 100% sensitive. So what does specificity and sensitivity mean? Sensitivity means that the kit will pick up that you have the virus. It's sensitive to the fact that you have the virus. Specific means it's not going to lie, that it's not really a different virus, or that the sky was too blue that day and make up a fake number. So you really want 100% for both sensitivity and specificity. 100% specificity is more important because it means you're not going to get a false positive, right? You'd like to pick it up. So Caramount, for example, is doing antibody screening on a real analyzer, not these little kits. It's an analyzer.
Like the home kits, right, where you prick your finger and it looks like a diabetes test.
Yeah, and FDA withdrew their approval of all those kits. Anybody who offers you a kit in your home, they're making something up. Princeton just released a saliva kit that apparently you can get to your home. They're real scientists, and that's a real kit. That's different, but that's not antibody.
Got it.
So I don't want to. The folks at Princeton, that was a real lab, real PhDs
who put it together.
They put a lot of time into it. That's a saliva kit for PCR, like the nasal swab.
Got it.
Anybody who's offering you an at-home kit, it comes from China and it's counterfeit. Whether it turns positive or negative, it's meaningless. So you want to get this done in a real lab. One of our local hospitals at Caramount, your doctor's office may be able to send that kit to a real lab like Quest or LabCorp.
Right.
Quest and LabCorp, I can tell you, are doing real approved antibodies on these major analyzers. All of them have 100% specificity like ours. So ours is done, for anybody who's curious, on an analyzer called the OrthoVitros. It's high speed. We do HIV on it. We do hepatitis serology on it. These people didn't just get into the business. You know, isn't it a little interesting how within 3 weeks of this happening that suddenly these companies were coming out with kits that they could make the diagnosis? You got to take that with a grain of salt. Yep. So all of the hospital labs, Quest, LabCorp, us, we're doing this on real analyzers that just had to make the antibody testing. But the analyzer technology was already there. Ours is 100% specific. There's different. So let's go into quickly the different kinds of antibody, because that's really important. So when you're exposed to the COVID virus, the real name of the virus is SARS-CoV-2, just in case anybody out there is a stickler.
Yep.
People do have a lot of time. I got a lot of sticklers out there. So the real virus name is SARS-CoV-2. The infection is really called COVID, like the disease is called COVID, but it's a lot easier to say COVID. So please, anyone who's
much easier,
an English major, please forgive me. We're going to call it the COVID virus. So when you're exposed to the COVID virus, you form antibodies. If you're lucky, then your body responds. Most healthy people will form some, but not everybody. There are different kinds of antibodies, something called IgG, IgM, IgA. Let's make it a little easier. We'll call it the M and the G. Most people's bodies make the M first within 4 or 5 days. The M peaks at about 2 weeks and then starts to fall. The G is the one that's usually more long-lasting. It may also start to come up in the first week, starts to get higher in 2 weeks, and it usually peaks around 4 to 6 weeks. Many people on the call have probably had Lyme disease or somebody in the family with Lyme disease, and you'll see the same kinds of antibodies. G and the M are not unique to COVID. It's really any kind of virus or bacteria that your body makes antibodies to. So there are different testing strategies, but what our analyzer does, and the analyzer at Quest, the biggest lab system in the country,
right,
we do a total antibody because it's more sensitive. It's more likely to pick up presence of these antibodies. It looks for IgG, IgM, and also something called IgA, which we don't know whether that's important or not, but it also looks for it. So if your total is positive, we then test your blood for the G. If your total is positive, if you're negative completely, it means, so negative total, it means you probably didn't have an infection,
right?
But it's not 100%. It could mean that you have an infection and it's really early, like in the first 5 days, or your body's not going to make a response. We don't know which, but it probably means the most likely thing is you were not exposed to the virus. Many people said, but I was sick in February, I was sick in January, I was sick in March. I'm really sure. There were a lot of other viruses out there still. So not everybody who was ill, flu was still going around. So some people who couldn't get checked for flu thought they had COVID probably had flu. So if your antibodies are negative, it doesn't absolutely mean that you had COVID and that the test is wrong. Any test could be wrong. All right. So if your total is positive, but your G is negative, that could mean you have a recent infection. When we see that, we then do a PCR. We want to know, could you be infected right now? Because people come in off the street and say, I feel fine, I just want to be tested. You could be carrying the virus. We know so many healthy people didn't even notice they had the virus. So it's a good sign, and some people use this as part of a testing strategy. Someone comes in really sick and it really seems like they have COVID. We do a PCR, and the PCR is negative. Unfortunately, the PCR is not 100% either.
Right.
So then you could do an antibody, and if the antibody is positive total and negative G, that's a sign that they probably do have COVID. So you can also use the antibody that way. Doesn't prove it, but it makes you very suspicious. If you have total positive and G positive, that means that you've probably had this infection a couple of weeks. So the $64 million question is, does this make you immune? We don't know. At this time, you have to assume no to be safe, right? Having antibodies, particularly having G, does not mean you could not wear a mask and tell your friends, I got the G, I don't need to wear a mask. No, right? It does not mean you could stop social distancing. It does not mean you could start just being reckless, hugging all your friends.
Right.
Can't go there. Could this mean someday that you're immune? Maybe. Right?
We don't know.
Right now, we just don't know yet.
Don't know.
Right now, we have to say we don't know, and you have to assume that you could get this again. And what if it protected you now, but in November, after the virus is mutated, it might not protect you then.
Exactly.
So this is not a free pass to anything.
So, Doc, if you had it in like January, would you still have and let's say you had it in January and you're testing now, or you tested last week, or you're testing next month, would the antibody still be there? I mean, is there any information on that? I mean, does it kind of like go away possibly? And you could have had it, but now it's been such a long time. You're testing that you didn't have it, but you know what I mean. Is that a fair question?
Yeah, no, it's a very good question, because we don't know yet how long the G will last, right? So if you were sick, anybody who thinks that this virus got to us in March is crazy, right? This virus probably got off an airplane in late December or January, because so many people travel back and forth between here and China and here in Europe. So it was probably running around in January. Mm-hmm. So you probably still do have antibodies. You would probably still have the G, just based on how other viruses and your immune system behaves. Mm-hmm. When you get a measles vaccine, for example, which you should if you hadn't had one, you can have antibodies for many years, right? You get a hepatitis vaccine, you should have antibodies for 10, 15 years. Some antibodies last your whole life. So 3 months is not that long, So 4 months, 5 months, you probably will still have antibodies. No guarantee. And if I didn't mention before, I really hate this virus because we keep finding out we're wrong when we say things. Right. But I think that you would still be positive for G.
Doc, what would you say the likelihood? We keep hearing about a second spike. Any thoughts that you could give to us? I mean, is that all predicated off of the next couple of weeks? Is that that seems what we're guarding against is a second spike, and that's why we're slowly reopening things in a very methodical fashion. But when we look at September, October, is that second spike real? Is that something that we think is an actual? I know it's real, but is that something that we foresee on the horizon? And you said before there were some complications between deciphering flu versus COVID. And by the time we get to September, do we know if we're going to be able to decipher the two any easier?
Okay, all good questions. So there are several spikes we're worried about. First, we're worried about we open up everything too fast and the virus is still in the community. So if you look at the numbers, New York State's done a pretty good job on testing huge numbers of people. They're looking at antibody, by the way, not PCR, to see who's had the virus. And the numbers vary depending on your neighborhood. If you're in far western New York, it might be 3% in your area. But down here, Westchester is going to come out somewhere between 11 and 14% of people who've had the virus. The city probably in that neighborhood or higher. I don't know where it'll come out because depending on where you test and when you test. But I'm going to guess it's going to be in the neighborhood of 11 or 12%. Yep. That still means that probably 80%, 90% of people can still get this again. So if we let down our guard too soon, it may not be you can call it a second spike. It just may mean that this wave is not over if we start to share the virus again. Until you get...
I'm sorry, go ahead.
So until you get to a point where you ever hear the term herd immunity?
Yeah.
It always made me laugh that we're a herd, just like a bunch of cows.
We heard about it out of where is it? Sweden? They keep saying Sweden's got herd immunity?
Yes.
Yeah, you've got to really get probably to 70% of people having it, but you don't really know with this virus. At some point, you may have enough barrier where it can't jump from person to person where it stops circulating. So the question is, when is it going to stop circulating? If everybody goes out and everybody stops wearing a mask and everybody's hugging and partying together and sitting too close to each other and coughing on each other, you're going to get this wave to go, we're not gone. So We're on the downside of the slope. If we're foolish, we go right back up. Yeah. So then the next question is, what happens in the fall? And the answer is, we don't know. Can this virus come back? Absolutely. Will we have a vaccine? That's really the big question. I'm really hopeful we'll have a vaccine this fall or more than one vaccine. That's probably the best way to get us out of this.
Right.
Maybe a drug, but I think a vaccine is much more likely. So could this come back in the fall and could it be different? Now, if you want to be a pessimist, it's going to come back and it's going to be more lethal, right? That's the worst case scenario.
Right.
But because viruses mutate, they can also mutate and become less contagious and less lethal. So that's also a possibility, or it could stay exactly the same. We know the virus is mutating, but not all mutations are bad, right? For a virus to live in people, it can't be lethal. If you want to be successful as a virus in humans, if you kill everybody, you failed, right? You failed evolution. You should have gone to class. You should have paid attention. You've got to be able to reproduce and get to the next generation.
I got to tell you, Doc, I've never, you're the first doctor that I've actually heard, speak of it that way. Because usually it's going to mutate, it's going to be worse, and it's going to, but I would say that I would venture to guess that, once you open things up, a spike, whether it's a small spike or, a spike doesn't necessarily have to be this huge thing, just like you mentioned. I think a spike would be, or more infections, or the rate of infections to rise a little bit at least. I think that's expected, right? Once you let people back out, So I think it's important that when we do open up, that we still practice our social distance, just like you advised, and the supervisor has advised, and that we still wear our masks, and so this way we could get people moving again in the right direction. When we were offline, you did mention one thing. You said that, you're seeing people come in with, Lyme's disease because they haven't been able to have access to get the medical attention that they needed, either because you guys are closed or, they can't get in because it's not, an urgent matter because the resources are being diverted to the COVID-19. And so, there's that factor as well, where you're saying you actually had your first case. I forget what you said. It was
babesiosis.
Yeah. So, I think that's another concern where, at some point, right, you got to expect that once you open it up, there's going to be some kind of an increase. The question is when does that point, when do we get to the point where we say, all right, you know what, it's a reasonably expected thing, but, we really do have to start getting herd immunity back in action, because I think keeping everybody apart from each other is detrimental as well.
So our reality is at some point we have to reopen, right? We're crushing our economy. People aren't getting the care they need. People are trapped at home. At some point, the world is going to reopen. We just have to do it sensibly. Everybody's got to wear a mask. When it's necessary, you've got to distance. And if there are infections, we have to prevent the spike. This time, because we understand it better and we can test, if someone tests positive, we're going to have to jump on them. We're going to have to find out where they were and who were they with and quarantine those folks. So we're actually in the 70s, the World Health Organization went out and basically wiped out smallpox. They called it a ring strategy. They put a ring around every village that had a smallpox outbreak. They didn't let anybody out. They vaccinated everybody. We have to put a ring around anybody at this point who is positive. See where they went, who they were exposed to, because it's inevitable that we're going to open, right? We're crushing the country. People are frustrated. They don't want to stay home. And I'll get to the fact that people they haven't gotten medical care, because it doesn't make sense to hide from COVID if you die from your diabetes.
Right.
So all we need to do is, the masks are really important. The hand hygiene is important. The other thing is, don't come out if you're sick. You still see people coughing through their mask. Don't come out if you're sick. You have to be that socially responsible.
Yes.
Get care, get a televisit with your doctor, but don't come out. Don't go to work sick. That mindset that, I don't want to let everybody down, you're not letting people down. You might kill them instead, because you don't know who's going to be vulnerable to this virus. So as we emerge, because we're going to emerge, we have to be smart about it. And the way to prevent the spike is with the masks, with smart distancing, with hand hygiene, with not going out sick and jumping on cases, because this time we're really going to try and do contact tracing.
Can you talk about that real quick? And then Councilman Lachterman, I'm not sure if you have any other questions on Facebook, but can you talk about the contact tracing? Because I think when people hear that you're getting an army of tracers and it's one for every 100,000 or something you need, whatever, I forget the number off the top of my head. Can you explain to people what that means? Because I think for some, there's clearly some nervousness about it. Who's tracing me? How, is government going to come knock on my door? Can you go through that a little bit and explain that to folks?
Yeah. So when you test positive, that's immediately reported to New York State. So that also then gets reported to your local health department. So Westchester happens to have a very good health department and a really good commissioner of health. So that's going to get reported to her people, and they are going to reach out to you. It's not a big brother operation, looking to read your Gmail account or your Facebook account. They want to know, are you safe at home? Or who are you exposing? Because if you live with 7 people, they all need to be quarantined. You need to be isolated. That's the difference between quarantine and isolation. You have to be isolated because we know you're contagious. We have to keep you hidden in a room safe. But everybody that you've been in very close contact with needs to be quarantined and watched for 14 days to make sure that they don't go out and spread it. Everybody's heard about this R number. If it's greater than 1, if every person with COVID infects 2 people, you know what you have your spike.
Right.
If everybody with COVID doesn't infect anybody else, no spike, right? You control those cases. So the contact tracing is about preventing the disease from spreading. Anybody ever see the movie with Dustin Hoffman, Outbreak? how the old
One of
Center
the
for
top
Disease
movies on
Control-
Netflix right now.
Yeah, it's worth seeing. It's pretty scary. So they go out and they see, where did this start? Who was patient zero? That's
Right.
really what you have to do. Everybody with COVID at this point is going to become patient zero. And are we're trying to break the chain to prevent them from spreading it.
That's a
So
great
Doc, I'm sorry. So Doc, the Yorktown Chamber has been getting quite a bit of calls. They're saying that the testing process, it's kind of difficult to actually even get an appointment for a lot of people. And there's been a lot of questions, believe it or not, call in the chamber asking what the test process is like. So hypothetically, I'm brand new. I want to call Caremount urgent care, I'm assuming, and I want to get a test. So starting from point A, what can you step us through briefly with the process, and what is that like?
Yeah, so we have not so I'm going to talk about Caremount for a second because I can't really talk about how other people conduct themselves. Some hospitals have helped counties starting drive-through testing. The problem with, and not that that's bad, because the drive-through testing does the PCR. But most people want to know now, have they been exposed?
Right, and that's what I'm talking about, Doc. I'm sorry.
Yeah, so what we like to do, we think the best way to do it is you actually get to talk to a doctor or your provider and say, what test do you need? Because we've had people come in for the antibody test and then say to us, you know what's funny? My throat's scratchy and I can't smell anything. I can't taste my food. Guess what? You have COVID. You don't need the antibody. You need the PCR.
Right.
So we talk to you. We do something radical. We talk to you first, and we see if you need the PCR or the antibody, and some people need both. But the process is, if you're one of our patients, you get a visit set up with your doctor, right? So it can be, we have a shameless plug, a beautiful new office on Keir Street in Yorktown with an urgent care.
Yes, you do.
You can get an appointment with your doctor there or any of our other locations. Some of the visits will be done by a telemedicine visit. Others, you can go into the office. The other thing we want to do by getting you to talk to the doctor is, people have been ignoring their health care. This is our opportunity to grab you and say, I'm going to get your blood sugar. I'm going to check your cholesterol. I want you to come in for a blood pressure check, or you bought a blood pressure cuff at the drugstore. Great. Put it on. Tell me your blood pressure. Let's talk about your medication. We're taking care of people with thousands of conditions. These conditions need follow-up. We feel that we could keep people safe in our offices at this point. We're doing the best we can with separation, letting people stay in their cars. We call them when they can come in. We're trying to keep people separated and time out the visits, and that's why we use the televisits. If your doctor orders the antibody, you're going to come in for blood, usually to one of our drawing stations, and they'll do the blood. Later this week, we're going to have our lab doing the nasal swab also. There's great news. You can actually do the nasal swab yourself, because it's no longer a jab yourself in the back of your head. You just take the swab, you rub it around the inside of your nose on the right, rub it around the inside of your nose on the left, pop it back in the tube, and you can hand it to the tech. So you can have a little bit of control of it. You don't have to worry about contaminating somebody else. But the blood work, your doctor will order it after talking to you, and you could come in and get the blood work, and they'll coordinate that with you. If you don't have a doctor, you can come into our urgent care. The weekends tend to be busier, but you can just walk in. You'll talk to one of our doctors or nurse practitioners, and they'll go through what you need. They'll also ask, are you a diabetic? Should I check your blood sugar? They can reorder your medications, people who are behind on We have people who haven't had medication in 2 months.
Right.
They
That's
just
a scary thought.
have forgotten about it. So this is a great opportunity to reconnect with healthcare. We saw after some of the big hurricanes, Katrina and in Houston, that there were more heart attacks, more strokes, more diabetics admitted to hospitals. People think, I can't go in, I have COVID. Dying at home from a heart attack is not worse than dying in the hospital from COVID. I guarantee it. Yep. So you have to think about your overall health care now. Now that the sun's out, the world's looking a little better, doesn't have to be our doctor, but get to see your doctor.
Great. Doc, thank you. Councilman, we have some questions from Facebook for Dr. Kohl.
Yeah, he may have actually answered, so I'm just going to, if you did yes or no, I was trying to answer different things back and forth, some that pertained to the conversation I just left. So do you know the specificity of the test that Caramount is using?
Yes, our total and our G have 100% specificity. So there are no false positives with the test that we're doing.
And that's a serology test, right?
That's exactly a serology. It is an FDA emergency use authorization approved testing method.
Then the question, what is the current best information? Is there evidence that either the M or G antibodies provide protection from further repeat COVID infection?
So there is no data yet. We are hopeful. The good news is if you're positive, you can potentially donate serum. And the reason you could donate serum, they turn that into a plasma, is because there's some evidence that some patients who are really sick with COVID got better when they got somebody's plasma. So if the plasma helped a sick COVID patient, there's a chance that it might help you if you're exposed to COVID again. But we don't know that yet. That's the frustrating part. So we're really hopeful that there will be some level of immunity. Complete immunity, don't know. Partial immunity, there's a chance of that, but it's still to be seen. I hate to be vague, but there is no trust. I literally scan the literature, the world literature, every day, looking for this answer to show up.
Yeah, well, with mutations, who knows, really?
And that's exactly true, because in the fall, if this virus really mutated, total protection today might not mean anything 7 months from now.
If kids are carriers, then would antibody testing help in stopping the spread?
So the biggest reason to test someone is to find out if they were exposed. That's really your main reason for getting the test, is you want to know were you exposed. If you're positive, your kids are probably positive. That's not 100%, because we've seen some people who managed not to catch it from the kids, but the kids were positive. So it's really a question of, do you really want to know? If every kid in the United States was positive, that definitely helps our herd immunity. So it's really a question of how badly do you want to know, and how badly do you want to know, are your kids positive and potentially immune? But again, hope is not a great strategy. I hope that having antibody will make you immune or will protect you partially. But again, we don't know.
Do you know if the problem at Caramount for prescription refills and the phones were taken care of? Apparently someone was talking about that on here. Yeah,
so phones have been difficult because we've had to close some of our locations. We were at one point seeing less than 1/3 of our normal daily visits, so we couldn't keep every location open. Fortunately, we were able to keep the Yorktown location open. So some staff wasn't working. We've had staff who didn't want to work. So we're doing everything we can to try and man the phones. You can send us electronic messages via your portal. If you have a portal account, you can ask for a medication refill that way. Getting a visit with your doctor now would be a great way to get the refills, but we're doing our best to man the phones. We apologize. We know at times it's been frustrating.
All right. There is a question. Will summer camps be open? Matt, I guess that's for you.
Yeah, it's a great question, one that we're getting quite frequently at this point. We haven't made a final decision just yet. We continue to have conversations with our Parks and Rec director, as well as our partners on the county and state level. We're hoping to have a decision made by the 15th, which is when the New York on pause order is set to expire, as well as a pool. So those are the two questions I get the most. And Doc, I hate to throw you a lateral here, but I'm curious from your standpoint, your insight or thoughts on this summer. Do you feel or do you foresee normal summer activity resuming?
I'm hopeful that certainly by July we'll be close. A lot is going to depend how many new cases. Could it just start to go away by July? It might. That we're not diagnosing any new cases, and then we're going to behave differently. I have good news about the pools, that people have not been able to find virus in kids' urine. So, and I mean that, no one's cultured the virus out of urine. So kids who pee in pools, don't worry about that. I'm sure some people out there were thinking it. So I'll get ahead of that. It's hard to say for sure. It depends. Everything depends on the number of new cases. Because if there are no new cases come July 16th, you can really open up your activities. If we're still diagnosing in the county 300 new cases a day, how can you let people run around and hug and play? You say it's just the kids, they won't get sick, but the kids run home to grandma.
It's safety and health and safety obviously is first and foremost in our minds making these decisions. I was speaking with some folks from the state. We've got FDR and we've got the pool. It's the largest pool of any state park in New York, right here in Yorktown. And they were fumbling with the same questions because it's not so much. I think everyone recognizes the water's not the issue. It's what's happening around the water. And how do you maintain social distancing with people, around the pool deck? And listen, I've got a 4-year-old at home. You try keeping him in a box of 6 feet, it ain't going to happen. You know what I mean?
So what's going to probably end up happening is you're going to get a compromise. You're going to end up with density limits. So you can't have 1,100 kids in the pool. Right. You might be able to have 200 kids in the pool, that everybody gets a 2-hour time slot.
Exactly.
That's probably where we're going to end up. I'm holding out hope that we're going to stop having new cases at some point between the end of June and July. Again, hope's a terrible strategy, but that's my hope. But I think that you're going to just have density requirements and just say, 200 kids to these 2 hours, the next 200 kids, these 2 hours. You'll try and do a quick cleanup in between because we want to try and go back to life, but we need the safer we do it, the less likely we'll have this second wave in the fall.
And another question for you real quick, just based off of that, and then we'll start to wrap up. When we think about safety and we think about implementing new safety protocols, any advice for our businesses and frankly, any advice for even, town government? We're already in the process of putting plexiglass in. I was over at Frankie and Augie's up in Jefferson Valley today. They have a pickup only, obviously, but you don't even go into the pizza place. They've turned it into a plexiglass covered pickup window and counter, which is great. But any thoughts or suggestions that you might have?
So you're going to see a lot of people. So the plexiglass is good. Anything that prevents someone's basically spit from getting to you. Someone coughs, they make small particles. Someone laughs very loud. Anything that prevents that from getting to your face, your mouth, your eyes is of benefit. Masks really do work. Plexiglass can be protective. You're going to see a lot of people taking temperatures to get into a building. We stop people at the front door. We make sure everybody wears a mask. We're going to be taking temperatures. The limit to temperatures is asymptomatic people could spread. People early in the course of COVID, less than half of them actually have a temperature. It's really important where in your place of work, ask each other, how do you feel? If everybody has to respond to how do you feel, don't get into people's medical history. Don't go there, HIPAA violation. But you can say to people, do you feel well today? Any trouble with your sense of smell? If nobody comes to work sick and everybody wears a mask and someone who wants to get into your building, you have to say to them, are you well? They then have to lie to you to get into the building because you do see people going out who don't feel well. Yeah. And if they know that they're going to be asked about how they feel, maybe they'll decide to stay home.
Yeah, I can tell you that here we do temperature checks at every town building already for our employees. We've been mandated to a reduction in workforce size, but we are having those conversations about, and I'm just trying to figure out how far do we go. I mean, and Councilman Lachman can join me on this, but like with our R&R crews, and our highway crews, do you put a partition up in the trucks now? If that's even feasible, which I don't think it is for most, but, is it, how far down do we go? Or, are the temperature checks and the staggered lunch times and those more basic parameters, are those enough? And I think that's what we're trying to grapple with.
Yeah, I think anybody who's in a closed environment, like two folks in a tight truck, that's dicey. If one of them gets it, hopefully, what I can tell you that the masks really work. Like we've had somebody with COVID coughing in medical professionals' faces, and they were masked and they had goggles on. They did not get it. Patients with absolute really sick COVID, it works. And the less sick somebody is, the less virus they make. At least that's how it looks.
Can you, and last question for you, I promise, goggles. And this is all information for me too, but because we do the masks, but we don't mandate goggles. We mandate masks. So should we be looking at goggles?
I like eye protection. In the open air, it's probably not necessary, but in an indoor environment, any eye protection is not bad. First, it stops people from touching their eyes. If you watch people during the day, everybody touches their eyes repeatedly. They touch their mouth repeatedly. One thing the masks do is they stop you from touching your mouth. And any kind of glasses, safety glasses, goggles get pretty tiring at work. But for your working folks, goggles are nice. They're very protective. You have no idea how many eye injuries we see every year in our urgent care. People hurt their eyes. So having eye protection on at all times is great. The nice thing about the goggles is they keep any sort of spit, saliva, these little aerosol particles from getting behind your glasses. But even glasses are a good idea. I'm very big on eye protection. And that's one thing those dividers do for you. That's why you see a lot of medical professionals wearing face shields. Anything that keeps it away from your eyes, because your eyes are vulnerable, as is your mouth and your nose.
Got it. Perfect. Well, Doc, listen, I really do appreciate the incredible insight you provided, not just to us, but to our residents. Again, this is streaming live on Facebook, on our website. It's on channel 20 on Optimum and 33 on Fios. It'll be continually played for the next at least 48 hours, as well as on our YouTube channel. So this information is really important for our residents, and this is why we do these things, is to help provide them the information so they can make really smart and socially responsible decisions. And we believe very strongly that information is power, and the more information we can give them, and I think the Yorktown's numbers prove it. I mean, again, we're at 33 active cases. We have less active cases than Somers. We have less active cases than Cortland. We have less active cases than Mount Pleasant, on par with Harrison. So I think that our town and our residents have done a tremendous, tremendous job. But again, it's about having this information. And to your point, it's making sure they understand it and they're not panicking not panicking, but also focused on what they can do to improve the situation. So I really want to thank you for your great insight today.
My pleasure. Everybody be safe. Happy Mother's Day, all. Thank you for having me, and keep up the great work.
Thank you, Dr. Kohl.
Councilman Lachterman, any last words?
Well, actually, Matt, I need to toss a question out for you to address. I know you already gave me an answer on this, but there's been a lot of commenting about the fact that an announcement went out that Governor Cuomo extended the pause New York until
Sure, yeah. So there was a lot of confusion this afternoon about this. I fell victim to it myself. So the governor's press secretary stated that the New York on pause was extended into June. Then it was retracted. Some of the staffers were going off of what the press secretary had stated. But definitively, we have been informed right before we started this Q&A that it has not been extended. The state of emergency for the state of New York has been extended, but specifically the New York on pause order was not extended as we were originally told. And so I believe there's been a number of press articles that were echoing the fact that they're going to be retracted. Bit of a mess, but for the record, it has not, according to the governor's secretary, Melissa DeRosa.
That's great news. That's great news.
Absolutely. And Sergio, any last comments?
Sure. I guess is the doc is gone?
Yeah, the doc has taken to the side here.
Well, I wanted to give them a shameless plug. We really appreciate the partnership that Claremont has with our town. I was there for their grand opening for the new building on Kear Street. And I told Dr. Hayworth the same. They really have top doctors, and it's unfortunate that Dr. Kohl can't hear this, but I found him to be extremely knowledgeable, extremely informative, level-headed. And I think, Mr. Supervisor, because of you delivered a lot of pertinent, important information to people today that, everybody was really confused about, So thanks for what you're doing, and thank you, Dr. Kohl.
Absolutely. And Sergio, thank you as well, and to our whole team. Councilman, any last words?
Everyone, be safe, be healthy. All the moms have a fantastic Mother's Day tomorrow. Hopefully we're able to, if your kids can't come to see you with the grandkids and maybe do a drive-by, just everyone be well. We're seeing the tail. I think we're getting to that point, and just keep focused to the end of the game here.
And that's the word, focused. And I think that you put that out there last week, and I agree with you 100%. Let's stay focused on being socially responsible. Let's stay focused on social distancing. To all the moms out there, a very happy, a very healthy Mother's Day. Wishing everyone the absolute best. And again, as we've continued to do, we will continue to provide accurate information that is valid as we get it. Again, our apologies on the confusion regarding the New York on pause order, because it was actually confirmed by the governor's office to me when I asked if it was in fact the case, and then it was retracted. But these things
on News Radio 88 also earlier. So
yeah, it's been reported across the state. But anyway, again, as always, stay safe, stay healthy, and we'll talk to you soon. Thanks so much, Yorktown.
Good night, all.